Hello, everybody. This is your 6-year-old carnivore friend, George from Bridgewater in Somerset, England. It's been a couple of weeks since last I posted. However, I've been very, very busy and I've had to actually write a script for this one, which is going to be the part two of Laney's cancer journey. However, a couple of small admin points to deal with first. I've just changed the name of this channel, so hopefully the transition will be smooth and I won't have lost any subscribers through doing it. Thanks to my great friend Stephanie for talking me through how to do it. Without her, I wouldn't have been able to do so. Secondly, as you know, we were looking at the possibility of a ticketed November meetup. However, we haven't really had enough response to make it viable, so that won't be happening in November, which is a great shame. But the Great British Meetup of the June of next year definitely will be happening. I am looking at the possibility of a much less formal mini meetup in November at that time. Um, However, that is not yet set in stone either, but I will keep you informed nearer the time if it does go ahead. But it's just again it's an idea which hasn't yet come to fruition. So those are the 2 points I'd like to the two admin points that I had to bring up. So we'll get into the story of Laney's cancer journey. To recap from the part one, she was diagnosed in September of 22, and the following year was all about um, her chemotherapy, her mastectomy, and then the radiotherapy afterwards. Once the radiotherapy had finished, that was the standard care taken care of. Um, and we had hoped that that would be it, really, and that she would sort of return to normal life. However, that wasn't to happen. The first clue that we got of this was from a letter in which the small print said that the biopsy on the removed tissue of her breast had revealed that she was suffering from a condition called Paget's nipple disease. I'll just give again. This is going to be scripted, so it's going to be a bit disjointed today, but I have to read it because I can't do it off the top of my head. So bear with me. So Paget's nipple disease is a rare condition associated with breast cancer. It causes an eczema-like changes to the nipple, and about 1 to 4% of women with breast cancer have Paget's disease of the nipple. So it's a very rare condition. Unfortunately, Lainy was found to be suffering from it. Now, interestingly enough, no oncologist or doctor actually consulted Lainy about this. It was merely in a letter which we received. So the only person I really got any sense out of was my great friend DC from DC Rebuilding down in Queensland, who is a cancer sufferer himself. So great. He sent me some research, so I was able to better understand it. So thanks very much to DC for doing that. However, it did cause complications, and it meant that the return to normal life wasn't possible. Lainey was given the status of disabled in this country, which meant that she couldn't actually return to work. So to carry on, so her cancer is node positive. It's human epidermal growth factor receptor 2, HER2 negative, and it is estrogen receptor positive, which is ER plus. Now, because the cancer is node positive, Lainey lost most of the lymph nodes in her left armpit. I think there were about 18 removed. Generally, the more lymph nodes that contain cancer, the poorer the prognosis and the higher the risk of cancer spreading to the other parts of the body. So that's not good. The prognosis is not good there. However, things are okay at the moment. But the removal of the lymph nodes meant that she is now left with a lymphedema in her left arm for life. So she will have to wear a compression sleeve on her left arm for life. and she has restricted movement in her left arm, which means that she can't raise it above her head as I have just done, so her movement is restricted. She has come to terms with the fact that this is going to happen, and she has now accepted the fact that the sleeve has become part of her daily attire. She's got a very natty new pink one, which she quite likes, but it is going to be a fact of life for now and for the, well, not even the foreseeable future, probably for for the rest of her life. Okay, so to move on to the HER2, she is HER2 negative, which is better than being HER2 positive, apparently. HER2 is a protein, and that's as much as I can really find out about being HER2 positive. Right, she is also estrogen receptor positive, and if your breast cancer cells have these receptors, which are proteins, then estrogen attaches to the receptors and it stimulates cancer growth. So obviously the estrogen is the problem. So she had to have some special ongoing treatment, which lasted for 2 years and actually finished on the September the 9th of this year. So though that special treatment, I'll go through the individual elements of it and then we'll put it all together. So firstly, she had to take letrozole for 2 years. In fact, that's still continuing. But letrozole is, the brand name is Femara. Letrozole is an adjuvant treatment, in other words, an additional treatment which helps stop the cancer coming back. It is an aromatase inhibitor that works by reducing the amount of estrogen the body produces, which can slow or stop the growth and spread of estrogen-dependent cancer cells. So the idea of letrozole is to reduce the amount of estrogen, and estrogen feeds the cancer cells. So it basically stops the cancer cells from having the necessary ingredients to multiply. The second drug that she had to take for 2 years was what is known as oral chemotherapy. It's called abemaciclib, and its brand name is Verzenio. It is a targeted therapy drug used to treat certain types of breast cancer, specifically ER positive and HER2 negative. And it works by breaking cyclin-dependent kinases 4 and 6, known as CDK4/6. They are enzymes, and this slows or stops the growth of cancer cells. So the use of letrozole and abemaciclib is a recognized standard of care therapy, and it lasted in Lainy's case for 2 years, from September of 2023 until September of 2025. Also, because of the Paget's disease, she has to have a course of bone infusion, which is intravenous bisphosphonates. Now, the active element is zoledronic acid, and a bone infusion of zoledronic acid involves an intravenous IV drip of the medicine into a vein to treat conditions like osteoporosis and prevent skeletal related events in cancer patients. This drug attaches to the bone, slowing down bone breakdown (brackets reabsorption) and increasing bone density and strength, which reduces fracture risk. The infusion typically lasts 15 to 30 minutes and is given at a hospital or clinic, with patients often prescribed daily calcium and vitamin D supplements, and she is indeed taking the vitamin D supplements, I believe probably the calcium too. Zoledronic acid is a type of bisphosphonate that works by inhibiting osteoclasts, the cells for breaking down bone. So that's the reason why she had to have the bone infusion. It's once every 3 months and does cause temporary side effects after having it. However, it also has a very rare long-term side effect, which is not good. but on the other hand, as Lainy said, it can only happen to me, and it did indeed. Okay, so a rare side of effect of bone infusion, intravenous bisphosphonates with zoledronic acid, is osteonecrosis of the jaw, or ONJ. So if we break down the word osteonecrosis, osteo means of the bone, and necrosis means death. We hear necrotic various stuff. It means that the bone or the tissue is dying. So basically, what it means is that her jawbone is dying. The bone itself is actually dying. It became quite apparent this was going to happen, so the IV bisphosphonates had to be stopped. And in April of this year, Lainy had to go into the maxillofacial department of Musgrove Park Hospital, which is our local hospital in the county town of Taunton in Somerset. And she lost some of her jaw and 5 teeth. So she came out and she now has gaps in her teeth, which is inconvenient when it comes to chewing. So she can't eat she can't eat a steak, for example, very well unless it's very tender. But she can eat the tender roast beef and eggs. So her go-to meal of choice nowadays is the roast beef, which she buys pre-cooked. So it's very tender and very thin. And also she likes corned beef as well, and so it's corned beef or roast beef with eggs is her go-to meal every day. One cruel but slightly amusing story is that when she did the raffle for the Great British Meetup back in July, the number 66 came out. And unfortunately, her because of she's lost certain teeth, she's left with a lisp. So to try to pronounce the word 66 didn't really work very well, and Carl the MC picks up on it straight away. But yeah, please don't ask Lainy to pronounce the word 66 again in the future, because she will simply choose to ignore you, and who can blame her? So the update on that is that on the 23rd of September this year, she had a checkup with the maxillofacial unit, and the surgeon was very pleased. The bone is healing nicely and no further loose teeth. So the ongoing prognosis is good. I like to think that the switching to the carnivore diet has helped the healing process, and they're perfectly happy. And apparently she will not now have to have another maxillofacial examination or examination of a jaw for another year. So she will carry on with the carnivore diet, and hopefully that will keep any further deterioration in the osteonecrosis department at bay. However, she will be returning to the intravenous bisphosphonates treatment, so there is a risk that might trigger further deterioration, but it's something that that will be monitored. Right, so after 2 years of the combination of letrozole and abemaciclib, on the 9th of September of this year, she had her final abemaciclib CDK4/6 inhibitors, and that was the end of the 2 years worth of oral chemotherapy that she was scheduled for. Now, we don't know exactly what happened next, but she became ill for a couple of weeks. It looked like possibly the side effects were letrozole. She had a bit of a problem with her kidneys that caused her to pee a lot, and there was lots of fatigue and a general feeling of unwellness, and it made her miserable for a couple of weeks because all the carnivore energy suddenly disappeared. However, it did go away, and she came back to life again and was absolutely delighted. And I'm delighted to say that energy is still continuing, and she is buzzing around like her usual carnivore energy-filled self, doing lots of housework around the house and basically, enjoying life again. So that's a good news. So that kind of brings you up to date with where we are today on the last day of September in 2025. The next phase is going to be very interesting, because she has been selected for a trial of a study drug, which is being sponsored by a company called Lainy over in New York. They are part of a much bigger group, and they are, I'm afraid to say, big pharma. The bigger group has a $4 billion turnover every year. I think we all know how we feel about big pharma. However, on this occasion, I'm happy to take the money and be very mercenary about it. So, just we are in the finalisation process at the moment. So, Lainy has had a CT scan. She's had what's called a nuclear bone scan, and the CT scan revealed a problem with her kidneys. Now, so she had to go in for an ultrasound scan 2 days ago on Sunday to see if there was any deterioration in the kidneys. However, by Sunday she was feeling very well again, with the energy was back, and the UTI, the problem with her bladder and the UTI had gone. The ultrasound came back absolutely clean for her kidneys. So what we're thinking, and I'm not a doctor, this is not medical advice. What I'm thinking is that while she was suffering that, she had a bit of inflammation of the kidneys, and maybe that is what the CT scan picks up: inflammation versus any tumor or any cysts, or any fibroids. So hopefully it was a temporary acute inflammation. It went away and the ultrasound came back clean. This means that she is nearly guaranteed to get on the 5-year randomized control trial, which is just starting. And on Monday, the 6th of October, in other words, next Monday, we have a full day down at Musgrove Park Hospital. She has to have an ECG and some blood tests. And then once they come back clean, she will then be almost certainly included in the 5-year randomized control trial, which means that she will get she will be considered a private patient under National Health Service, which means that she will get first-class treatment, which includes also expenses as part of this trial, which is good because parking in this country in hospitals is prohibitive. If you are obliged to park for more than 12 hours at that hospital, it costs you £16, which is approximately $24 or thereabouts. So it is great that we are being subsidised by this big pharma company over in New York. Very grateful to them, and ethically you can make your own minds up about it, but we are quite happy that she will be part of this. It will be an open label study. The 50% of the participants will be allocated the study drug, and the other 50% will be allocated the standard of care, otherwise known as a standard endocrinal therapy. And in this case, it will be Lainy continuing with letrozole. However, if she is selected for the other half of the study, she will be treated with the study drug, which I won't name here because I'm not quite sure whether it's confidential or not. But either way, she's going to, as part of this randomized control trial, she will receive the best treatment possible, and she will be constantly monitored. So that is very good news. So that kind of brings this episode up to date. The new chapter will start on October the 6th. So in a couple of weeks' time, everything will be clear, and I will be able to report back with part 3 of this series. And it will be basically, we will have a better understanding of what the 5-year randomized control trial actually means for her treatment and the way we're going. So I will do part 3 in a couple of weeks' time. And until then, I really can't think of anything else that I need to report at the moment. So I'm going to sign off and wish you all very great health, and keep eating the meat, and basically keep on enjoying life, as I'm sure you all will. Okay, so bye bye for now. I'm going to hit the button. Beep.